All right, guys. So we are going to talk about cardiac catheterization this week. So, cardiac catheterization is also known as a heart cath, and it is a minimally invasive procedure. However, it is invasive. They do actually insert something into your body. So, minimally invasive procedure that allows your doctor to examine your heart's function. And during this procedure, a thin, flexible tube is called a catheter is inserted into a blood vessel, whether that's in the groin at the femoral artery, in the arm at your brachial artery, or in your neck and your carotid artery. So, any of those three options. In this particular image, you see the example of the femoral artery. So the doctor then threads the catheter through the artery and up into the aorta until it reaches either the heart chambers or the coronary artery, excuse me, depending on its intended destination. And this is just a little bit of a closer up view of the catheter moving from the aorta up and over the top of the heart into one of the coronary arteries, the right coronary artery specifically in this particular image, just so it kind of gives you an idea of a little bit more up close view of that trajectory. So, cardiac catheterization serves various purposes in diagnosing and treating heart conditions. So, your doctor might use it to diagnose coronary artery disease, which involves those blockages in the heart's arteries due to plaque buildup. Maybe to identify problems with the heart valves, such as narrowing or leakage, and evaluate congenital heart defects, such as structural abnormalities that are present since the time of birth, and also assess the pumping function of the heart muscle. And there are different types of cardiac catheterizations and of the different types of procedures depending on what the goal of the procedure is or why they're doing it, right? So, some common procedures include the coronary artery angiogram. And this involves injecting a contrast dye into the coronary arteries to create an x ray image that visualizes any blockages in the coronary arteries. Then you've got a ventriculography. Um, this is where your doctor uses a contrast dye and x ray again to assess the pumping function of the heart chambers. Then you have a valvuloplasty, and this is where a balloon catheter is used to open narrowed heart valves. Also, a stent placement, which we'll talk a little bit more about in a moment, but this is where a little tiny mesh tube is inserted into the artery to help prop open a narrowed artery and improve blood flow. And then you also have ablations. And this is a procedure that actually destroys a small area of heart tissue on purpose, which is causing abnormal heart rhythms. So that area of heart tissue is causing the source of an abnormal heart rhythm, and they go in and basically zap it and get rid of that part so that those abnormal heart rhythms are no longer. So here is a little bit of a more up close view of a stent placement. A stent placement is a common procedure performed during a cardiac cath to achieve coronary artery dilation and improve that blood flow to the heart. It's particularly useful for treating coronary artery disease where that plaque is building up in the arteries and narrowing those arteries, resulting in restricted blood flow to the heart muscle, causing things like angina, which is chest pain. And this dilation helps to improve that blood flow and alleviate these symptoms. So, before a cardiac catheterization, you will have a consultation with your doctor to discuss the procedure, its risks, answer any questions that you may have. Make sure that you do go into that appointment with prepared questions so that you make sure that you get all of your questions answered. Also, you may have some blood tests that could be required in order to be able to have all of the information that your doctor needs to decide what's going to happen with your procedure. And you also might be instructed to stop taking certain medications. Very frequently, you're told to stop taking a blood thinner, for example, for a certain number of days beforehand, or maybe ibuprofen or something like that. So there are some medications, not always, that they'll ask you to do that, but sometimes they will. And during the procedure, you will receive local anesthesia at the insertion site. So that's just like, let's say they're going in the femoral artery, for example. You're going to get a little bit of numbing medication right there in the groin where they insert the catheter. This is not a, totally out under general anesthetic sort of procedure. The doctor then inserts that catheter and then performs the necessary tests and while continuously monitoring your vital signs. And during the procedure, you are then observed for a few hours. Following the procedure, you're observed for a few hours to ensure that you are, recovering smoothly. And then you'll get your discharge instructions and then a follow-up appointment typically. And then, and then you have your period of recovery. So that's where they are doing that observation, making sure that you're not having any complications, that sort of thing. So if you guys do have any questions about that cardiac catheterization or any of those different procedures or reasons why they actually do those procedures, do let me know. You can always post a comment down here below the video, or you can always shoot me a message. That's no big deal. Do make sure that if you are going to just shoot me a message, post a comment just letting me know to look for it, because sometimes those go to my spam folder or message request folder and I don't see them for a couple of days. I do try to check that regularly, but I'm not always on top of that. So if you do have any questions, let me know and I will see you guys over in the group.